Clinical trials are the gold standard for evidence-based medicine, but would you consider participating in one if it meant you would get plastic surgery for free?
People do it all the time.
It's mixed out there.
Mixed results in the audience. We also asked our social media followers this question. 50,000 of you voted. 79% said no. I wouldn't get plastic surgery for free as part of a clinical trial.
I mean, it's going on, though, a lot. And you may think clinical trials are reserved for new medications and life-saving treatments, but they're for cosmetic treatments as well. In fact, here on the Doctors, I was part of a study using a new saline breast implant with a different design. And I did the surgery in the office, and we revealed her on the show, but she was part of a clinical trial. Since then, that implant has been approved and is now on the market.
Yeah.
So we do it all the time. And in plastic surgery, we do these studies, clinical trials. How do you sew the inside of the face compared to the other side? So people agree to do it. They do one thing on one side of the face and they don't do it on the other side, and then compare the results. That's how you learn,
though, right? Is that you're always looking for safety and efficacy, so there has to be a comparison group. And one comment we found online says, I'll be part of a clinical trial where they'll do 2 different fillers in each laugh line on my face. Can this cause a major difference in the 2 sides? And I think that's always the concern, right? If there's going to be a placebo versus an active agent, or something done and nothing done.
Can I answer this as the non-dermatologist, non-plastic surgeon? Yes!
Can I as the non-dermatologist, non-plastic surgeon? Yeah.
Well, when these new products come and the rep comes, we jump on the table, and it's not that we're cavalier, but we know that if there was some unevenness or something, that we would be able to correct it.
And the FDA tries to protect patients, but there are risks to everything. So when you're picking patients for clinical trials, how do you manage their expectations?
Well, so I think that's the key, because if you're just doing it for a freebie, and then you're going to be extremely upset when one side of you doesn't match the other for 6 or 12 or 18 months, because remember, these trials go on for a long time, and you can't usually do that correction until you've run the course of the trial. I mean, that's one of the conditions of recruitment. So
it's all about informed consent.
It's all about informed consent.
And I think you tell them, hey, you're going to look better, and down the line, if things aren't right, we may have to do some sort of touch-up procedure.
And in some trials where you're maybe expecting a difference, you may then pay the trial participants, because they're not only going to want it for free, but if there's a risk of asymmetry, well, I want some money.
You hear those,
and they do.
You hear those on the radio all the time. You're driving along, and do you have depression? Do you want to be part of a clinical study? We will pay you. We will, drive you back and forth.
And that sounds enticing, but my concern also is that one study said 3/4 of subjects will lie to get into clinical trials, and that is less than ideal, because you have those qualifications for a reason. And so if you don't fit the criteria, then you're not a good candidate, so you shouldn't lie.
But the thing is, the demand for this is tremendous, and you're absolutely right. People shouldn't lie, but people who can't necessarily afford these procedures, they're going to lie about their pre-existing medical conditions, they're going to lie about their allergies, they're going to lie about what they've already done, because there's so much demand and so much desire to do these at a discount or to get paid. One person's experience was she got a tummy tuck and made $2,500 profit.
Right, because they wanted to try out a new type of tissue glue.
Exactly.
And they agreed to do it, so she got a free tummy tuck plus got paid.
Yeah,
and let's take one moment right now to applaud clinical trials in this space, because it's really easy, and look, we've been victims on our show. It's really easy to take one person, show a before and after picture. You don't even know what they've really done to this person, what filtering has occurred, and say, this procedure works great. Look at this person. At least in a clinical trial, you can truly test something and figure out if it's something that you can use more broadly. Clinical trials gold standard, and it should be in the plastic surgery, dermatology world, just like it is in internal medicine,
I mean, in
cardiology.
OB-GYN, with all the birth control pills and IUD devices and all those were tried in clinical trials.
The key to a good trial is transparency on both the trial participants, the people conducting the trial. We know that not everything is transparent in medicine. There are a lot of scams out there.